All right, so today we're going to take a deep dive
Ooh, deep dive.
into the world of penicillin.
Okay.
We're going to uncover how it works, why it matters, and why it's still making headlines in 2024.
Okay.
Our guide for this journey is a YouTube lecture by clinical pharmacology, Dr. Khaled M. Hassan.
That's good.
And don't worry,
Yeah.
you definitely don't need a medical degree to appreciate the fascinating stuff we're about to uncover.
I like that.
Yeah.
So what's interesting is that penicillin isn't just one simple solution.
Oh,
It's got this three-pronged attack on bacteria.
a three-pronged attack.
Yeah.
So it's not just like hitting a pause button on the bacteria. That
Yeah.
sounds way more complex.
Way more complex.
Yeah.
Picture the bacterial cell wall as a fortress.
Okay.
Penicillin targets this fortress in a few fascinating ways.
Okay.
First, there's something called covalent binding.
Covalent binding.
Imagine a molecular handcuff
Okay.
latching onto essential proteins in that bacterial cell wall. And the really important part is that this binding is irreversible.
Okay, so that's one handcuff. What are the other two prongs doing?
So the second attack focuses on an enzyme called transpeptidase.
Transpeptidase.
Now, to build their fortress walls, bacteria need to create these chains of amino acids.
Okay.
Those are the building blocks of proteins.
Yeah.
Transpeptidase is like the construction crew, linking those amino acids together. Penicillin swoops in and blocks this enzyme,
Okay.
essentially halting the construction work.
So the first attack locks them up,
Yes.
and the second stops them from building defenses.
Yes, that is correct.
Got it.
Yes.
What's the final blow?
The third part is where it gets really interesting.
Okay.
Penicillin triggers the bacteria's own self-destruct sequence
Oh.
by activating autolytic enzymes.
Okay.
It's like flipping a switch that tells the bacteria to initiate its demolition protocol.
Wow. So not only does penicillin attack from the outside,
Yeah.
but it also turns the bacteria's own defenses against itself.
'Cause-
That's crazy.
That's why penicillin is called bactericidal.
Okay.
It's not just slowing the bacteria down, it's
Right.
wiping them out.
Got it.
And the lecture even had this visual of the bacterial cell wall,
Mm.
showing how penicillin creates these pores that lead to cell death.
Okay, that visual really helps me understand how it all comes together.
Yeah.
But you mentioned earlier that penicillin's effectiveness isn't universal.
Right.
So are there certain battlefields where it's more or less effective?
Absolutely.
Okay.
Penicillin is like a specialized weapon,
Okay.
working best against certain types of bacteria.
Gotcha.
It generally excels against gram-positive bacteria.
Okay.
These bacteria have a simpler cell wall structure,
Right.
making them more vulnerable to penicillin's attacks.
So their fortress walls are easier to breach.
Exactly.
Okay.
However, with gram-negative bacteria,
Yeah.
things get more complicated.
More complicated? How so?
Their fortress walls have an extra outer layer
Mm.
that penicillin needs to penetrate.
So it's like they have double the defenses.
Yes.
Yeah.
And that outer layer can be tricky to get through.
Yeah.
Some gram-negative bacteria have these tiny doorways called porins
Morums.
that allow penicillin to enter.
Okay.
But others, like Pseudomonas aeruginosa,
All right.
are much tougher nuts to crack
Yeah,
because they lack these porins,
Oh.
making them highly resistant to penicillin.
So it's like an ongoing arms race
Oh.
with some bacteria evolving ways to outsmart penicillin. I'm starting to understand how resistance develops.
You're getting it.
Yeah.
And that brings us to another challenge. Staphylococcus aureus? Or staph? You've probably heard of MRSA, right?
Yeah, MRSA.
Yeah.
I know it stands for methicillin resistant Staphylococcus aureus,
Uh-huh.
and it's a big problem in hospitals.
That's right.
Yeah.
Some strains of staph have modified their penicillin-binding proteins.
Okay.
Those molecular handcuffs we talked about earlier.
So they've essentially changed the locks on their cell walls.
Precisely. This modification makes them resistant to many penicillins,
Right.
making MRSA a serious concern.
It's fascinating, but also a little bit scary
Yeah.
how bacteria can adapt and fight back.
Yeah.
But here's what's really blowing my mind.
Okay.
Penicillin isn't just one drug.
Yeah.
It's a whole family of drugs
A family.
with different strengths and weaknesses.
That's a great way to think about it. It's like a dynasty with different generations evolving to tackle specific bacterial threats.
Right.
The lecture broke down penicillins into 4 main categories.
Okay, let's start with the original penicillin, the one that started it all.
Right.
What can you tell us about that?
Well, the originals are called the natural penicillins.
Natural penicillin.
With penicillin G and penicillin V leading the charge.
Penicillin G and penicillin V.
Penicillin G is only available as an injection.
Okay.
While penicillin V can be taken orally as a pill.
Okay, so one's a shot and one's a pill. Why the difference?
It has to do with their chemical structures and how they're absorbed by the body.
Gotcha.
But here's a fascinating fact.
Okay.
Penicillin G benzathine.
Penicillin G benzathine.
A type of penicillin G
Okay.
provides long-lasting protection.
Okay.
It can be used for syphilis or rheumatic fever, and a single injection can provide weeks or even months of coverage.
So you get one shot and you're good to go for months.
It can.
That's incredible.
Yeah.
What about the next generation of this penicillin family?
That's where the extended spectrum penicillins step in.
Extended spectrum penicillins.
Amoxicillin and ampicillin are the stars here.
Amoxicillin and ampicillin.
They offer broader coverage,
Okay.
tackling not only those gram-positive bacteria, but also certain gram-negative ones.
Right.
E. coli and Haemophilus influenza.
So they've expanded their territory on that bacterial battlefield.
Exactly.
I see how this family tree is evolving.
They're the go-to choices for common infections,
Okay.
like bronchitis, pneumonia, and urinary tract infections.
But even with these advancements,
Yes.
we still had to address those tough staph infections.
Right.
Especially MRSA. Right? We talked about how some staph bacteria change the locks on their cell walls.
Yes.
So how did scientists tackle that?
They developed the anti-staphylococcal penicillins.
Anti-staphylococcal penicillins.
These are the heavy hitters, like methicillin, nafcillin, oxacillin, and dicloxacillin.
Whoa, that's a mouthful.
It's designed to take on staph infections head-on.
So they're like specialized warriors
Yeah.
trained to target those modified penicillin-binding proteins.
Exactly.
Gotcha.
But there's a catch with methicillin.
Okay, what's the catch?
While it was crucial for identifying MRSA in lab tests,
Okay.
it's not widely used anymore
Okay.
because of the risk of kidney side effects.
I see. So it played a key role in identifying the problem,
Yeah.
but isn't the best solution for treating it?
Right.
Okay, so we've covered the originals, the expanded spectrum,
Yeah.
and the staph specialists. What's the final branch of this penicillin family tree?
The final branch is the anti-pseudomonal penicillins.
Anti-pseudomonal penicillin.
The ones specifically designed to combat those tough gram-negative infections,
Okay.
including the formidable Pseudomonas aeruginosa.
So they're like the elite force going after the most resistant foes.
Yeah, that's a great way to put it.
That makes sense.
These are the big guns.
Cool.
Carbonicillin, ticarcillin, and piperacillin.
Wow.
They're powerful antibiotics.
Yeah.
But even they need reinforcements sometimes.
Reinforcements.
Yeah.
What do you mean?
Well, remember those beta-lactamases we touched on?
Yeah.
Those are enzymes that some bacteria produce to break down penicillin,
Right.
rendering it ineffective.
Oh, right.
Yeah.
It's like they have their own tiny weapon to fight back against penicillin.
Exactly.
Sneaky.
And to counter this, we often combine these anti-pseudomonal penicillins with a beta-lactamase inhibitor.
A beta-lactamase inhibitor.
Think of it like sending in backup to protect the penicillin and make sure it can do its job.
So it's like a two-pronged attack on those resistant bacteria.
Right.
This is also fascinating.
Yeah.
I'm seeing how complex this bacterial battle really is.
It is.
And it's amazing how scientists have figured out ways to adapt and overcome these challenges.
Absolutely.
It's amazing.
Yeah.
Okay, so we've covered how penicillin works and how it's evolved to combat different types of bacteria. But I think it's time to talk about safety. What are the potential side effects of penicillin?
Well, penicillins are generally considered very safe, but like any medication, there are potential side effects to be aware of. It's always about weighing the benefits against the risks.
Right, that makes sense. So what are some of the most common side effects people might experience?
Probably the most well-known side effect is hypersensitivity, which is basically an allergic reaction.
Oh yeah, I've definitely heard of penicillin allergies.
Ew.
But how serious can those reactions actually be?
It really varies. They can be mild, like a skin rash, but in some cases, they can be quite severe and even life-threatening, like anaphylaxis.
Anaphylaxis, that sounds serious. What exactly happens during that kind of reaction?
It's basically the immune system going into overdrive. Symptoms can include a rapid drop in blood pressure, difficulty breathing, swelling of the face and throat, and even cardiac arrest if not treated immediately.
So it's definitely not something to take lightly. What should someone do if they think they might be having a reaction?
If you've ever had any kind of reaction to penicillin, even a mild one, it's crucial to let your healthcare provider know. And if you experience any severe symptoms like difficulty breathing or swelling, seek immediate medical attention.
Absolutely no messing around with those kinds of allergic reactions.
Yeah.
Okay, so besides hypersensitivity, what are some other potential side effects?
Diarrhea is a fairly common side effect, especially for young children. It's usually not serious, but it can be a real nuisance, especially for little ones.
Yeah, I can imagine. What about more serious side effects? Are there any we should be aware of?
There are a few rarer but more serious side effects, some of which are associated with specific types of penicillin. For example, methicillin, which we discussed earlier, has been linked to a condition called nephritis, which is inflammation of the kidneys.
That makes sense considering we talked about how methicillin isn't widely used anymore because of its potential side effects.
Exactly. And then there's neurotoxicity, which can manifest as seizures. This is extremely rare, but more likely to occur with very high doses or if the medication is injected directly into the central nervous system.
I understand. You wouldn't want those powerful antibiotics near the brain or spinal cord unless absolutely necessary. It seems like there's always this balance between fighting the infection and minimizing potential side effects.
You've hit the nail on the head. It's a delicate balance, and every medical decision involves weighing those factors.
So are there any other potential side effects we should know about?
There's also hematologic toxicity, which involves blood-related issues like anemia or a decrease in platelets. This is more commonly seen with ticarcillin and carbenicillin, those anti-pseudomonal penicillins we talked about earlier.
Okay, so it sounds like there's a range of potential side effects from mild to severe. But overall, it seems like penicillin has a pretty good safety profile.
That's right. And it's worth pointing out that penicillins have a big advantage over some other antibiotics in terms of safety.
Oh, what is it?
Unlike some antibiotics where blood levels need to be carefully monitored to avoid toxicity, penicillins don't usually require routine blood level monitoring. This makes them easier and safer to use, especially for outpatient treatment.
That's definitely a win for penicillin. It sounds like despite the potential side effects, penicillins are still a crucial part of modern medicine.
Absolutely. Their discovery revolutionized the way we treat bacterial infections, and they continue to save countless lives today.
It's amazing to think about how many people have benefited from this one discovery. It really highlights the power of scientific research and innovation.
It truly is a remarkable feat of science. And speaking of innovation, it's fascinating how the penicillin family has evolved to target specific types of bacteria and combat resistance.
Right. Like we talked about those beta-lactamases, the enzymes that some bacteria use to break down penicillin. Yep. We briefly mentioned them before, but I think it's worth diving a bit deeper into that bacterial counterattack.
I agree. It's a crucial part of understanding the ongoing battle between bacteria and antibiotics.
Okay, so let's break it down. How do these beta-lactamases actually work?
Imagine them as tiny molecular scissors, specifically designed to cut apart the beta-lactam ring, which is what gives penicillin its power.
So they're essentially disarming the penicillin before it can even reach its target.
Precisely. This is one of the primary mechanisms of bacterial resistance to penicillin.
It's incredible how bacteria have evolved their own defenses.
Yeah.
But then again, we've also evolved ways to fight back.
Right. You got it. Scientists have developed ingenious countermeasures, and that's where beta-lactamase inhibitors come into play.
Right. It's like sending in backup to protect the penicillin from those molecular scissors.
That's a great analogy. By combining penicillin with a beta-lactamase inhibitor, we can effectively neutralize the bacteria's defense mechanism and restore penicillin's effectiveness.
So it's like a constant chess match between scientists and bacteria, with each side trying to outmaneuver the other.
That's a great way to put it. And one of the most common examples of this combination therapy is Augmentin, which combines amoxicillin and clavulanic acid.
Augmentin, that rings a bell. Isn't that often prescribed for ear infections?
Yes, it's a common choice for ear infections as well as other infections where resistance is a concern. It's a great example of how we've been able to overcome resistance and keep penicillin relevant in the fight against infection.
I'm starting to appreciate just how complex and fascinating this world of bacteria and antibiotics is.
It's a world of microscopic battles and constant adaptation, and understanding these intricacies is crucial for developing effective treatment strategies.
Okay, so we've talked about how penicillin works, its evolution, its safety, and the challenge of resistance. But I'm realizing there's one key aspect we haven't covered yet, the spectrum of activity.
You're right. That's a critical piece of the puzzle. We need to understand which specific types of bacteria are susceptible to penicillin and which ones are not.
So it's like knowing which battles penicillin can win on that microscopic battlefield. I'm ready to explore that in our final segment. So let's talk about this spectrum of activity, like figuring out where penicillin is most effective on that microscopic battlefield.
Yeah, exactly. Penicillin isn't a one-size-fits-all solution. It's more like a specialized weapon.
Right.
Effective against certain types of bacteria, but not others.
So where does penicillin really excel? Which bacteria are most vulnerable to its attacks?
Penicillin's main strength lies in its activity against gram-positive bacteria. Remember how we talked about their simpler cell wall structure that makes them particularly susceptible to penicillin's mechanisms?
So it's like their defenses are easier to penetrate.
Yeah. Precisely, penicillin can effectively disrupt their cell wall synthesis, ultimately leading to their destruction.
The lecture mentioned some specific examples, right?
Yeah, there are a few key players on the gram-positive side. Streptococcus species, for instance, are generally very susceptible to penicillin. They're responsible for a range of infections from strep throat to pneumonia.
Oh, okay. That's good news, considering how common those infections are, especially in kids.
Yeah.
Are there any other gram-positive bacteria that penicillin is effective against?
Another important group is the Enterococcus species. They can cause urinary tract infections and other complications, but they're typically within penicillin's reach.
Okay, so those are some of the major gram-positive bacteria that penicillin can tackle. What about the gram-negative side? We know those can be trickier.
You're right. Gram-negative bacteria have that extra outer membrane, adding an extra layer of defense that penicillin has to overcome.
It's like they have reinforced armor.
Exactly. That makes it harder for penicillin to penetrate and reach its target. But there are some gram-negative bacteria that are susceptible to penicillin, especially those with porins.
Right, those are the tiny channels that allow certain molecules to pass through that outer membrane.
Exactly. Think of them as entry points for penicillin. Some examples include Neisseria gonorrhea, which causes gonorrhea, and Haemophilus influenza, which is often involved in ear infections and respiratory tract infections.
Interesting. So even though they're gram-negative, they have these vulnerabilities that penicillin can exploit.
That's right. But on the flip side, there are also many gram-negative bacteria that are resistant to penicillin, either because they lack porins or because they've developed other resistance mechanisms.
We talked about Pseudomonas aeruginosa earlier, which is known for its resistance. Are there other gram-negative bacteria we should be aware of in terms of resistance?
Yes, many Enterobacteriaceae, a large family of gram-negative bacteria that includes E. coli and Klebsiella species, are becoming increasingly resistant to penicillin. It's a growing concern.
So it's this constant evolutionary arms race, with bacteria finding ways to outsmart our antibiotics. What are the real-world implications of this growing resistance?
It means that infections caused by these resistant bacteria are much harder to treat. We often have to resort to more powerful antibiotics, which may have more side effects, and in some cases, we might not have effective treatment options at all.
It's a sobering thought. It really highlights the importance of responsible antibiotic use and the need to develop new strategies to combat resistance.
Absolutely. Overuse and misuse of antibiotics are major drivers of resistance. It's crucial to follow healthcare providers' instructions and only take antibiotics when they're truly necessary.
You know, this whole deep dive has been incredibly eye-opening. I feel like I've gained a much deeper understanding of penicillin, how it works, its evolution, the challenges of resistance, and now this spectrum of activity.
It's a complex but fascinating topic, and I'm glad we could break it down together. What are your main takeaways from this deep dive?
Well, I think the key message is that penicillin, even though it's been around for a while, is still a vital tool in our fight against bacterial infections. But it's not a magic bullet, and understanding its limitations is just as important as understanding its strengths.
I couldn't agree more. And I think this deep dive highlights how science is constantly evolving. We're always learning more, adapting our strategies, and searching for new solutions. Who knows what other amazing discoveries await us in the world of antibiotics?
That's what makes science so exciting. There's always something new to discover and explore. Thanks for taking this deep dive with us. We hope you've enjoyed the journey and come away with a greater appreciation for this remarkable drug. Until next time, stay curious.